Hi, welcome to my channel. My name is Naarah Bethel. In this video, I am going to be talking about how to handle a STEMI or NSTEMI patient. So I am the owner of Hydrolux IV Bar and Med Spa in Columbus, Georgia. I am also an ER travel nurse. I am very excited to talk about this because this is like one of the patients that always comes into the emergency department, and it creates a lot of learning opportunity. So whether the patient has a STEMI is a patient that's actively having a heart attack. An NSTEMI is a patient that's not actively having a heart attack but has elevated troponins. A troponin is an enzyme that your heart gives off when it's under stress, and this is what we use as a marker to see if you have an active or inactive a heart attack going on. So when a patient comes in with either a STEMI or a non-STEMI, NSTEMI, the first thing you want to do, EKG, especially if they come to triage. EKG has got to be done on the patient whilst you're collecting information. If the patient comes in via EMS, then the first thing you want to do, get them on a monitor, get that EKG. We always want to know what the vitals look like. So if a patient is having chest pain and their EKG is showing elevated QRST complexes, you need to know that. So put them on the monitor, get that EKG, get an IV. You definitely need an IV, and make sure you're getting the labs also and sending them over to the lab. Even if the doctor has not put orders in, as long as the lab is down in the lab, they can start the processing. So when the orders are put in, you can just call the lab and tell them, hey, these orders have been put in, can you run the test? This patient is a STEMI or an NSTEMI patient. So main thing, getting that EKG done on that patient. It needs to get done so we can see if they're actively having a heart attack or if it's just elevated troponins, or it's an NSTEMI. And you're going to be preparing that patient to either go into the cath lab, which requires, usually in most facilities, some facilities will tell you you need to get the patient cleaned up in the ER with the chlorhexidine and everything. In some facilities, the OR is going to be called and they're going to come in and get the patient themselves and do that whole process upstairs because of the sterile field. But you got to prepare the patient for the cath lab because you need to go to the cath lab. They're going to see if they're having a blockage anywhere in their heart so that they can bust that clot. But that is how you handle a STEMI and an NSTEMI patient. You got to get that ER just make sure that you're getting that EKG done, and do not panic. When you panic as a nurse, I know it gets a little hectic, and as a new grad or as a seasoned nurse, you want to panic. That does not solve anything. You have to make sure you are grounded. Yes, the patient is having active chest pain. Yes, they need medications, but we need to stay grounded. We need to not panic. You can't have two people panicking at the same time. That does not solve anything but creates chaos. You have to make sure you're calm. Even if you're freaking out inside, do not let the patient see that you're freaking out. Just take care of the patient, answer their questions, walk outside, go to the med room, and go freak out there. Okay? Do not freak out in front of the patient because that makes it even worse. But that is how you handle an NSTEMI or a STEMI patient. I hope this is helpful. Thank you for watching. God bless you. Have a good one. Bye.